So as we look at the trochlear notch here, then this big bony projection posterior to the trochlear notch is the olecranon process, and this elevation on the anterior aspect of the trochlear notch is the coronoid process. And if we put our elbow back together, what you'll notice is as you flex your elbow, the coronoid process goes in the coronoid fossa, and as you extend your elbow, the olecranon process goes into the olecranon fossa. So as we're looking at our ulna, then the other thing that's in the proximal end of the ulna is this real smooth surface here. And this is where the head of the radius sets against the ulna and actually pivots so that we can accomplish actions of the forearm that we call pronation and supination. And so this surface, the radial notch, is a critical one for knowing left or right. So in anatomical position, the trochlear notch has to be anterior and the radial notch has to be lateral. And if you get this anterior and this lateral, then you'll have it in the correct position. And as you'll see again, this is a right ulna. Now if we go to the distal end of the ulna, we'll notice that the distal end of the ulna has a real rounded surface. So the ulna is the exception of the bones in your body in that all bones except the ulna, the head is proximal, but in the ulna, the head is distal. So you can kind of think of the ulna as the only bone in the body that stands on its head. Now, other than the ulnar head, we actually have a very prominent projection off the ulnar head, which is called a styloid process. So in anatomical position, if you're looking at your wrist, this bump we're seeing right here in line with our little finger that we can feel right here is the styloid process of the ulna that you're actually able to palpate. Now the other bone in the lower arm, or the antebrachium, is the radius. And we'll notice that the radius has a real rounded head. And the way the two bones fit together is that the radius head fits in the radial notch, so that they fit together like this. And then if we construct the elbow, again, you can see how the capitulum is going to articulate with the head of the radius. So the radius head is proximal. And then as we've talked about in other bones, if we have a head, the restriction under it is a neck. And then this very enlarged area of the radius is called the radial tuberosity. Now the radial tuberosity is the attachment of the biceps muscle. And so the radial tuberosity has to be anterior, so that will help you with left and right orientation on your radius. As we go to the distal end of the radius, what we'll notice is there's a smooth groove that is on the lateral aspect of the radius, and that is where the head of the ulna articulates. And then on the opposite side, there's a projection again, which is a styloid process. And what we'll see if we put the bones together is that the styloid process of the radius and the styloid process of the ulna create a little cup in which our carpals, or our wrist bones, are going to sit. So as we look at a left hand, or excuse me, a right hand, which would be in line with mine, then what we have is we have 8 little bones that we can count. 1, 2, 3, 4, 5, 6, 7, 8. So again, 1, 2, 3, 4, 5, 6, 7, 8. So we can think of the carpals as being 8 bones that occur in 4 rows. And then we can do the first 4, and then we can go to the second 4. So as we start with the thumb side, then the bone on the thumb side is the scaphoid. As we go out to the next bone right here, it is the lunate. We go to the next bone, it is the triquetrum. And then sitting on top of the triquetrum is this really small bone called the pisiform. So 1, 2, 3, 4 are scaphoid, lunate, triquetrum, and pisiform. Now, on the second row of bones, if we go back to the thumb side again, then the bone on the thumb side is called the trapezium. The next bone is called the trapezoid. The next bone is called the capitate. And the last bone is called the hamate. So if we look at them all together, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Now there's a little risque ditty that helps students learn it. So some lovers try positions that they can't handle. And that oftentimes helps students learn the bones and the order of the bones. Now as we progress down the hand, then the bones that are associated with these carpals are called metacarpals. And with metacarpals, we number them, starting with thumb side being 1 and little finger side being 5. So the way we'd identify them, for example, if there was a fracture of this bone, is that it would be 1, 2, the second metacarpal of the right hand. And then anybody reading what you wrote would know exactly what bone you were talking about. So much of what we work on in anatomy is trying to become very good at being specific at communication. So first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and fifth metacarpal. Now as we move out to the phalanges or phalanges, then they make up our fingers. Our thumb is unique and it only has 2 bones. So we can use descriptive terms, proximal for the first bone, distal for the second bone. And following the numbering pattern we started with the metacarpals, then this would be the first proximal phalanx, second proximal phalanx, first proximal phalanx, first distal phalanx, and then second, third, fourth, and fifth. With all of our other bones, we actually have 3 bones. So this is the proximal phalanx, this is the intermediate phalanx, and this is the distal phalanx. So if we were dealing with this little bone right here, then we would say it would be the third distal phalanx. And then everybody would know which bone you were referring to. So that concludes our discussion of the upper extremity.